And good morning. Welcome to Deuk Spine Institute. We are streaming live spine surgery throughout the day today. It's Thursday, September 19th. Our first patient has cervical facet joint pain. She injured her neck years ago, and she's developed arthritis in the facet joints. We're going to show you what that looks like and why it happens in just a moment. She is intubated because she's having her laser surgery done right after the facets. So on the x-rays, you're going to see an endotracheal tube and an esophageal temperature probe. But we're going to start by zapping the pain nerves to the facet joints. And Henry, why don't you show the audience why people get facet pain? Shot.
Copy that.
And welcome back. You see from our animation that facet pain actually comes from inflammation within the facet joint. What causes inflammation? Well, it's your body trying to basically heal an area that's been damaged. What's damaged is the facet joint. Trauma is the cause of almost all facet injuries, not all. There is also autoimmune rheumatoid diseases like rheumatoid arthritis can cause it. Psoriatic arthritis can cause it. But in the end, it's some type of an inflammatory process. Jordan, can you zoom in a little more so I could see a little bit better? All right. I think it would be the other. Is this the panel, the detector here?
Yes.
All right, so the emitter is down lower?
Yes, sir.
Very good. All right. Now, the vast majority of facet joint pain comes from arthritis, from trauma to the facet joints. Very little comes from rheumatoid arthritis, psoriatic arthritis, other types of arthritis. So, in this patient's case, she doesn't have rheumatoid arthritis, psoriatic arthritis. She has osteoarthritis. And osteoarthritis is a very common cause of facet pain, as you saw in the video. Now, how do we treat it? In the past, we did a procedure called radiofrequency ablation. Unfortunately, that treatment doesn't work or it doesn't last. So we had to develop a new treatment that was a bit more aggressive at fixing the facet joint pain. You could see the tip of the probe, Jordan. Why don't you show the audience the tip? And that's right where we want to be. That is where the pain nerve is. Shot. The exact location of the pain nerve. Just right there, shot. Exactly where the tip is. We call that the medial branch or the dorsal ramus. Medial branch of the dorsal ramus. Now, let's show our audience how the Deuk plasma rhizotomy works. Henry?
Copy that.
All right.
Facet joint injury is a common cause of chronic neck pain. The inflamed facet capsule tear generates pain signals. The best treatment for facet joint pain is the Deuk plasma rhizotomy. The inflamed facet joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-NECK 349-6963.
Welcome back. You can see how our Deuk plasma rhizotomy, which is a patented procedure, by the way, that I developed here at Deuk Spine in maybe 2 years ago, how it works. It is more energy delivered at the end of our wand. We call it the plasma wand. And the plasma wand is movable, so you can move it around to make sure you sever the pain nerve. The problem with regular rhizotomies is that they cannot move around to make sure you get the pain nerve. You have to put the probe in one place and leave it there and burn. The problem is, of course, that in a lot of patients, the nerve is not exactly where they put the probe because the nerves are kind of thick. They're thicker than the probe. In many cases, I just felt the nerve right there. We're done with the left side. We're going to move to the right. But basically, I want to inject too some medicine. Do we have it yet? Yeah. Thank you. This is a painful procedure compared to our other surgeries like laser surgery, which is not really painful. Shot? So I want to put a little bit of numbing medicine and some medicine down here just to help her with the pain she's going to have after surgery. All right. If you have questions, feel free to type them up and I'll answer them. We are streaming live. Shot? Let's, the neck is a bit rotated. Somebody, can we just try to unrotate it a little bit? You can see the spinous process is trailing off to her right side. Shot? I just want to get, there we go. That's so much better. Yeah, thank you. Jordan, you could probably correct it a little bit more than that. Feel free to ask questions. I'll do my best to answer them during surgery. Shot?
We do have a question coming from Rose on YouTube.
Sure. I just want to show you guys the arthritis. Jordan, show them how much arthritis there is in these facet joints. That was the left side, but look at the right side. There's more. All that dark stuff, it's not normal. It's bone spurs and arthritis over there. You got a thickening of the joints. Shot? A thickening of the bone around the joints. All right, we'll take Rose's question.
Saying, hello, I am set up to get a back injection tomorrow and I am nervous. I got hip injections last month. One kind of helped, but the other one made it worse. Bad pains shooting down my leg. It seemed he hit my sciatic nerve and it's been very bad. Can barely walk for the past 3.5 weeks for the right hip injection. I'm worried about the back injection going wrong. What are your thoughts?
Yeah, great question, Rose. So first of all, come to Deuk Spine and get fixed. Stop these injections. The injections never last. That's the most important take home. These doctors doing injections, they're doing it because they don't know how to fix the problem permanently. We do. So I would recommend you come to Deuk Spine and get a permanent fix. The way you do that is we offer a free MRI review. You submit your MRI on our online website, and Henry will put the link there, and you just click on that and come in, fill out a few questions like where's your pain, and that way we have some information on the patient before we do the MRI review. Send us your MRI either by CD, mail, or upload the images. The instructions are on the website, or give us a link to your portal and we can access your MRI. But the point is that your injections are never going to fix your problem, ever, ever, ever. They don't. Your body will never heal the problem on its own. It just doesn't. So I think I know what's going on with you. I think you have probably a piriformis syndrome based on what you're saying. But I don't know that until I do the Zoom call with you. It's free. There's no obligation to treat with us. There's no advertising, no sponsorships, nothing. We just will tell you what's wrong, answer some questions. It's all free. It's done virtually from the comfort of your home. I strongly recommend it. Yeah, I mean, people need to know that shots can have complications. Just so is surgery. Surgery can have complications. It really depends on your doctor and how good they are. And there's a lot of bad doctors out there, is what I've learned over the years. A lot of doctors who don't do treatments properly. They don't have the right technique. They don't have the right equipment. They don't have the right medicine. They don't have the right operating room or team to help them. I would say, in my opinion, that of all the surgeries and procedures done for back and neck pain, 99% of them are not really very good for the patient. They're good for the doctor because the doctor makes money. The facility makes money. That's how they pay their bills. But it's not helping people, and they need to stop. We discourage injections. We recommend permanent fixing. That's typically what we do for our patients. We don't recommend injections. Now, some people just don't want anything but injections, you know. That's just their opinion. That's fine. It's their body, their choice. But from my standpoint, you know, you've done so much. Is that it? You've done so much to come into the doctor's office and get treatments. You just need to go a little bit further, come to Deuk Spine, and let us actually get rid of your pain. That would be my advice. All right, I'm done, Dr. Berndes. So are there any other questions? Because we're going to end this stream, and
Yes.
we're going to come back in a few minutes with our Deuk laser disc repair, which is the next procedure she's having. You have another question, Henry?
Yes, this is coming from Raj on YouTube,
Raj.
saying, "Hi doctor, what's going on? Can I ask you, why does a disc replacement surgery after time cause facet joint pain? Does it increase the arthritis, or is it because some of the fake discs are hypermobile?"
Yes, we don't recommend artificial discs for a lot of reasons, but most importantly, they're invasive, they're unnecessary. We can now fix all back pain without putting any metal implants in your body. An artificial disc is an implant. It's a piece of metal. You have to have an open surgery. They have to put it in where the disc was. You don't need any of that done anymore. It's absolutely unnecessary. It's dangerous. Artificial discs, fusions, laminectomies, discectomies, all the surgeries these surgeons are recommending, avoid them. The future of spine surgery is laser endoscopic, which is what we're going to do next here on this patient. So if you come back in 30 minutes, you can watch it. And plasma, which is what we just did. So plasma and laser do not involve open invasive surgery like artificial disc. So the problem with artificial disc is your pain could be coming from the facet joints, or the disc itself if it's failing, or the adjacent levels above and below could be the source of the pain. We don't have any of those problems at Deuk Spine Institute. If you have our procedures, we can fix your facet pain and your disc problem with laser and plasma, and there's no adjacent segment disease. There's no implant failure. So avoid implants. But if you are having pain and you already have the implant, we can help you. You just need to do an MRI review.
And then one more question coming from Jason on YouTube, asking, does Dr. Deuk shave or laser the cervical/facet bone arthritic thickenings and or calcifications to relieve the pain?
No, we don't need to shave any calcifications. We don't need to shave facet arthritis. All you need to do is destroy the pain nerve to the joint. It's called the medial branch of the dorsal ramus. That nerve has one purpose, and that is to carry pain from a painful joint up to your brain. You cut that nerve and you can have an absolutely normal life, no pain in your neck or back. It goes away immediately. There is a little pain with the procedure, but that goes away in a few weeks, sometimes a few months in different people. But there's no reason to shave anything down. Lots of people have arthritis in their joints. They have zero symptoms, no pain, no symptoms at all. Our goal is not to cure arthritis. We can't. Our goal is not to take your joints out, because that's highly invasive and unnecessary. The goal is to eliminate pain and restore movement, normal movement, and that's done with what you just saw. All right, thank you for joining us. We'll be back in 20 minutes with our cervical Deuk laser disc repair for 2 herniated discs in the neck.